Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Good morning.
Good morning. We have a crowd here. How do we get a crowd at 7 in the morning?
We always get you a crowd, you know.
You always bring attractive people here, too.
Well, you know, I've been working with Dr. Rammohan now for some times. As a matter of fact, we go way back. You know, we spoke back in the days about working together. And, you know, everything is when the time is right. So the time was right this year. And we had been working together. He's a very busy man, and we had been, you know, anxious to bring him to the show because it's so hard to get an endocrinologist, first of all.
Explain to people what an endocrinologist, or do you want Dr.
Well,
Ram
we're going
to
to
do
have
that?
Dr. Ram be able to talk about
what it is, right?
what it is to be an endocrinologist. But those people that suffer from not only the common conditions like diabetes and thyroid disease, you know, endocrinologists go way beyond that. There's a lot of different conditions. Dr. Ram and I saw a young man, very young guy, I think he was in his late 20s, with elevated blood pressure. And between me and him, we were able to do the workup to make sure that one of those exotic endocrinological conditions was not his problem, like certain tumors that can present at a young age. So we were able to work up without his presence at AGI. It would have taken a long time to get the workup done, and we were able to do it, Dr. Ram, in 2 or 3 weeks?
Yes, about 2 to 3 weeks. Normally, if you have to put them in a hospital, the expenses would have been thousands of dollars and 3 to 4 days. But we were able to adjust the workup schedule such that it was not inconveniencing the patient in any way.
What did you have to do to do a workup? What did that mean?
These are specialized blood tests. First of all, we should go back one step. Sometimes there are telltale signs when you examine a patient. For example, this condition we are suspecting called pheochromocytoma very often can give a clue when you first examine, and the examination will show something called café lait spots. It's a French term, obviously. It's like milk on coffee, like a faint black spots on the skin. So we look for it. And if it is there, it increases our suspicion. Then we look for something else called neurofibromatosis, you know, small tumors under the skin. And if you have either one or both, then your index of suspicion rises very rapidly. He didn't have any. The question always is, why should a 25-year-old young man have high blood pressure? High blood pressure is very common, but in relatively older people. The younger people are not immune. But whenever there's a young person, we look for what we call secondary hypertension. The most common hypertension is essential hypertension or primary hypertension or cause unknown. But in younger people, we look for an underlying reason. Because if there's an underlying reason, you can fix it and the blood pressure is cured forever. So we put all our thinking cap together and keep digging in and try to look for all causes. It could be a birth defect, something called coarctation of aorta, where there is some kinking in the main blood vessel of the body. Or it could be a tumor. It could be a tumor in the adrenal gland. Or it could be a neuroblastoma, some other rare exotic tumors. So it's very important to make sure a patient doesn't have something. It's often easier to say that there is something wrong with you rather than saying there is nothing wrong with you. It takes a lot more expertise to say there's nothing wrong.
But the tests are really where you had to go. And Dr. Mencia is very good at what you're talking about for everybody, not just for your particular specialty, because you always look at a person, you talk to them, and sometimes they came in for something that had nothing to do with you find out.
Exactly.
Which is amazing to me. But you have you've done this for so long. That's why I always tell people, please go for a second opinion with Dr. Mencia. Don't jump into getting all these prescriptions and not know what's happening, right?
Yeah. Well, yes. I mean, you have to be a good diagnostician. You have to be a good clinician. I teach, a lot of the students from Nova University and other educational center here in South Florida. And I always tell the student, you have to be a good listener and a good observant. So I observe the person walking, when they walk into the room, when they talk. I have one patient that came in for diarrhea, and I diagnosed her with thyroid cancer because when she was moving, when she would speak, her throat, it was not symmetrical. You can see a lump. So I say, have you ever been diagnosed with any thyroid disease? This is before I even touched the patient. And she goes, no, never. Right? And I said, okay, let's do the examination. So we did the examination, then we did what we call an iodine uptake and so on. And we did the whole workup, and we made the diagnosis. So a lot of times, and I tell the student, don't be a secretary. Don't send the patient to Dr. Ram for him to make the diagnosis of diabetes. You have to do the initial workup for the specialist. And that's how I work with all my specialists. I do as much as possible. So when the patient go now to the specialist, the more than the basic stuff have been already ordered, so we can move on to the next step.
So when would you send one of your patients to Dr. Ram?
Well, Dr. Rammohan and I, we manage a lot of the diabetic patients. So we are building up this diabetic center because we have the dietitian. We have 3 of them. We have Dr. Rammohan being an endocrinologist and myself as either an internist or a geriatrician. So we have a team together to work toward helping the patient with conditions like diabetes, thyroid disease, the different endocrinologic or tumors that can present. And the beauty is that Dr. Rammohan being with us, it makes the process of getting an endocrinologist to see you a lot much faster. So we get to the diagnosis faster. And sometimes Dr. Rammohan will say, okay, just follow with Dr. Mencia. I'll see you in a year. But Dr. Rammohan, why don't you tell us a little bit why you decided to follow on the career of endocrinology?
You just were reading my mind. I was going to ask you
I've been doing this for some year with you.
Well, you're stealing my thunder.
And what is endocrinology?
Endocrinology is the study of hormones. Everybody has heard of the term hormone, but it's kind of a common term, but often misconceived or misunderstood. We call hormones the second messenger from God or from the higher centers. For example, let us say you want to do something, whatever that invocation or inspiration comes from somewhere, and then your brain tells the body, say, the arm, move the arm. But then, how did the arm move? There has to be a chemical signal. That chemical signal is a hormone. There's something called acetylcholine, which has to activate some of the chemicals. There is something called cyclic AMP, which should initiate the impulse. So it's amazing that a tiny little chemical can do so much, and without it, no matter what you do, what you think, what you want to do, nothing can be exercised. So we call it second and third messenger from God. That's one. Second thing is, I studied in med school way back in 1960s. Those days, we didn't have much of specialization. There were not much of technology. For example, CAT scan, ultrasound, all these things came back very recently. So the tendency has been for many physicians who are forced due to lack of time or whatever, and they have to end up ordering tests and keep going. And Dr. Mencia just pointed out, God has given you 2 years to observe, 2 eyes to observe, 2 ears to listen. So put them to work first. And I had professors who were extremely good in clinical diagnosis. They won't even touch a patient, as Dr. Mencia was talking about his patient with that medullary carcinoma of thyroid causing diarrhea. The first thing to do is listen, examine, and then go from head to foot. I do not touch the patient. First, check from head to foot. Can you put your head down? I want to look at your scalp. Let me look at your eyes. Turn left, right, open your mouth, this, that. And then only I start examining the patient. And because we didn't have much of technology, we had to use our clinical acumen. We had to put a stethoscope, listen to the heart and lungs. We hear something called bruit. Sometimes we put the stethoscope over the belly to look for not only bowel sounds, for any leakage in the aneurysm, in the aorta, etc. So you put all your skills together. So that's one reason. This and most of these people who specialize in endocrinology happen to be good clinicians also. They're good diagnosticians. So that kind of motivated me to go in that direction. And again, if you would look back a few decades, all the advancement in medical science first happened in endocrinology. For example, the Nobel Prize winners, they were the one who, from a VA hospital in New York City, found out a methodology, Burson and Yalow. They found a technology where you can measure the minutest particles in the blood. Before that, if you want to measure your calcium, it is like, say, 10 milligrams. If you want to measure glucose, it's 120 milligrams. A milligram sounds big, but it is still a very small quantity. But when you're talking about the hormones, you're talking about 1 millionth of a milligram. 1 billionth, I don't want to say billion, that may be a little exaggeration. In millionth of milligram. So how are you going to find that out? So these people devised a technology called radioimmunoassay, when suddenly the medicine started advancing very rapidly. So all the advancement you will see in medicine happened in endocrinology, the field of endocrinology in late 1950s and 1960s. So I got fascinated, so got into that.
So that's what happened. So you became a geriatrician.
Because of my grandpa.
Right. That's right.
Yeah, because my grandpa.
But it's interesting, Dr. Mencia, you have the most interesting people who you bring here. And are they all working with you at the AGI, or are these just people you have found and you want them to be associated? How is all this working?
Well, I still follow my dream of, originally was for the geriatric patient, all of us working together. And, the people that work with me, the AGI, we are all independent providers. So it's not a big institution that has all this money and say, go and do whatever program you want. We work together. And the objective is here having, some companies are employee center. We want to make sure the employees have maternity leave, the employees get to eat lunch, the employee get to do this, get to do that. My company is patient center. Of course, we honor the employee, we honor the provider, we honor everybody that is part of the team. But we all have to remember each and every day when we start the day that we are all patient center, that we are all there to work together. And sometimes I might have the dermatologist in his patients, but I get a case that I pull him into the room and say, come, even though he might not take the insurance, come, let's look at this case together. And we might spend 5 minutes together. But we have probably saved 3 or 4 months of workup on that patient by putting our brain together and trying to come up. And sometimes the dermatologist will come in and say, will you look at this? Or the podiatrist will say, Dr. Mencia, will you look at this? What's your opinion? Which way should we go? So I think that's the beauty of all of us working together. And, I think I have been blessed by God, first by having great staff that work with me. Very supportive.
Pointed to Ina.
Like Ina.
One of
Right. Great staff that work with us, because without them, and I tell people, sometimes doctor ask me, like, Dr. Mencia, how, I opened the center being here only 3 or 4 years. Say, how you do that? You inherit some money or something? I say, no. I believe in having great support staff, and then I do the best by seeing patients and helping patients, and the support staff set up meeting and set up lecture and talk to the student that's going to come and all those things. And usually in a practice is either the husband or wife, whoever is the doctor, see the patient, and then the significant other will go ahead and run the practice. And I ran away from that. I said, no, I need professional people to be a manager, professional people to be an accountant. Because, a lot of times we do bad, not because we are bad people, because we cover area that don't belong to us. So, for example, Dr. Rammohan, when he's seeing patient, if I'm calculating and sending stuff to insurance, most likely I'm going to make a mistake because I don't know about that stuff. Not because I'm a bad person, not because I'm a thief, but we have professional people that respond to him, and I say, okay, we build this, and then we give them input, because we go to training, we go to program, how we can do things better. But we always leave it up to them to do that portion so we can do what we do best, which is to take care of patients.
The one thing I noticed, though, is you do find people like Dr. Rammohan.
Yes, you got it.
Yes, I got it. And that's the interesting part, that many of the people you have brought here seem to have the same kind way. I can look at him and see his eyes. I always know about people from their eyes, and I can just tell. But he has to be a real expert, or I know you enough. So now moving over, Dr. Rammohan, can you tell me, here's one of my new questions, right? In all your history, what has been the most unusual case that maybe you have ever had?
Well, very interesting.
So you got to remember that one.
This is, and I'll start, this was within the first few months after I started my practice. And this is late 1970s. And believe it or not, for about 5-6 months, I didn't have a patient. For whatever reason, because I'm new, people are not used to seeing somebody like me.
You probably look like a little kid. I can see, because you look so good now. I'm sure it was
anyway, I was literally struggling. So there was a physician, he's a German physician. He said, Ram, I know you're good, but I'm going to be out of town. Would you mind seeing my patients? I said, okay, I'll be happy to see. At that time, I was doing not only endocrinology, but also general medicine, because I had to survive. And of course, we are trained in internal medicine first. Then you become endocrinologist. So you don't forget what you're putting your base on. So this young lady comes in, her initials, only I will mention KB. She was about 14-year-old. I was practicing in a small town about an hour away from Cleveland. So the sister brings the patient, and then she tells me, Doctor, would you mind giving her some cough medicine and antibiotic? I said, I don't prescribe medicine because what you want, but I need to know. Tell me what is the thing. So she set up an appointment. She was waiting. I was just passing by the examination room, and I heard this young kid coughing. And this is how the cough sounds. That's not a cough. Cough is, but she was coughing. That's a very unusual cough. It's called bovine cough. This is how a cow will cough. So how many people would have listened to a cow coughing, right? Okay. But this is how they've been taught. So I told the patient, look, I cannot give an antibiotic. I need to examine, but give me a little bit of history. You look too young. Who is this patient? She said, my sister. Where are the parents? Because I may have to talk something more serious. She said, no, see, she's from Cleveland, and there's a lot of drug problem there. So she's living with me here in a small community, etc. I said, okay, I may have some news for you, but let me examine her. Because she had that bovine cough, I knew that she had a paralysis of a nerve called recurrent laryngeal nerve. Recurrent laryngeal nerve, there's one on the left side, one on the right side, and the nerve has to go from the some near the heart it has to go up towards the vocal cord, and definitely was getting paralyzed. So I examined her. I put my fingers on her neck. I can feel the lymph glands on both sides of the neck. Then I let her lie down. I can feel a little bit of spleen. So I immediately knew that this patient has something of the nature. It's a cancer of the lymph glands called a lymphoma. So I ordered a chest X-ray. I sent to the radiologist. He calls me back. Ram, how long has this patient been on chemotherapy? I said, no. This girl, I just saw her. How the heck did you make the diagnosis? I said, well, I listened to the patient, I examined, but tell me, does she have a lymphoma? I said, yeah, she has a lymphoma. As I had put there stage 3 or 4, and you're absolutely right. She's a stage 3 lymphoma. So I referred the patient to a very famous institution, 1 hour from my town. And you won't believe this story now. I didn't hear for a day.
I'm going to stop you for 1 second. We're going to let you continue. But people are listening, and they need to know how to be able to come down to AGI to see you and Dr. Mencia. So let me do that. And then hold that. I want to finish hearing this. We need more time with him.
That's very interesting story.
The phone number, I always get so interested. The phone number is 954-489-1345. They're there on Saturdays. They're there all week. But let me give you that again, 954-489-1345. Call, make an appointment. They do home visits also. They also have someone told me they're going to go out to the Boynton Beach. They called me and they said they're making a reservation because twice a month.
Next
Dr.
Thursday
Mencia,
I'm there.
What
next Thursday I'm there.
And but I'm not going to even give you that phone number. I don't want to spend. I want to hear the rest of the
Yeah,
story.
that's very interesting. Story.
Okay, so now what happens?
You send him the
Okay, I don't want to mention the name.
No, don't mention the name.
All right. So this patient goes there, and I didn't hear for a couple of days. And then 2-3 days later, Dr. Paul Dement calls from that institution. He's a very well-known pediatric oncologist. He says, Dr. Rammohan, I just want to find out, how did you make this diagnosis? I told him the same story. I was listening to bovine cough. Oh, my God, I've heard of that term long time ago. I didn't even know what it was. Is that how you made the diagnosis? I said, yes. He says, where did I go to medical school? I said, I went to medical school in India and, went the whole story. And he was fascinated how the diagnosis could be made, just like that. Then he said, I want to tell you a small story. It's very common in big institutions with big names, medical schools. They would present a case. This is how the medical student will start. Such and such a patient was referred by a primary care physician in a small place, as though the person who referred is more or less nothing. That's how they would present.
Right.
So this fellow in hematology presented that case, and then we found out he did not take enough, seriousness into what you mentioned. That patient came here in the late afternoon. They kind of took it for granted, put the patient in the ward, in the clinic for further management. Middle of the night, the patient went into something called an acute superior vena cava syndrome. What happened, those lymph glands in the chest kind of bulged, put pressure on the blood vessel that is returning blood into the heart and putting back into circulation. She went into coma. So they had to call the radiation oncologist emergency during the night to give emergency treatment so that they can shrink the tumor. And luckily she survived. And the oncologist said, my God, you made the diagnosis. You sent to a big tertiary center.
Amazing.
We are so-called big name center.
Yep.
Our people did not take it seriously enough, and we almost lost the patient. Something like that. So
I'm so thrilled, and you're going to have Dr. Ram back again. I mean, I'm sure he has more stories like this.
Absolutely.
And I applaud you
Thank
for
you.
knowing the right kind of people, to help your patients, because I think that story is repeated
this
many
is a good
times that you do.
introduction
Yeah,
on
very
Dr.
good.
Rammohan. It's a great
And
clinician.
he's working with you.
And he's working with
So
us at the center.
That's a wonderful thing, and I thank
And
you
we are
very
very
much.
proud.
And out of time.
We didn't even get to talk to hormones.
I know.
Well, we're
talk
going to have
about
you
you.
write something in the Boomer Times, but we'll have you back again. I'm sure Dr. Mencia
look
would
at
love that.
Look at the next edition of
Yeah.
Boomer Time.
Okay.
He will write an article, most likely
Fabulous.
on the thyroid.
Okay, we'll do that. Thank you very much.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.